Today I want to talk about massage. A lot of people like massages. Massages are good, definitely, no doubt. Now, having been a chiropractor for 34 years, people come to me. Some people had massages and they felt good. Some people had massages, they got worse. So what's the deal with a massage? There's many different types, as you probably are aware of now. I'll just kind of give you a little bit of run. There's a Swedish massage, which is like really light, you know, touch, and they do kneading and rolling and percussion, different styles, but basically it's very soft and gentle and fairly safe for everybody. Then there's a deep tissue massage, the one they go in there, and sometimes they go with their elbows, or some places with their knees, sometimes using sticks. I don't know about that one. I don't like it. The body does not like force, does not like to be too much. Maybe there's a place for it, no doubt. But again, that would need to be used with caution. And then I'll explain to you in a bit. But let me just, there's also trigger point massage, and then there's reflexology massage. They do the feet, the hand, the ears. It's good. There's the aroma, massage. They use different essential oils as they are working. There's also the Thai massage, which is nowadays in California here is very popular, and I'm seeing a lot of injuries from Thai massage. So I caution you, Thai massage. A lot of times, what they do is they end up, they have these young ladies, you know, hanging on to rails on top, and then they're walking on your back and try to crack your back and try to push things. And big guys usually they like you, and like, yeah, that's great, and they walk out. But the thing is, I've seen a lot of injuries from that, and that's not necessarily good. Even being as a chiropractor, when I tell people like we adjust and we restore proper curvatures and we align the body, it's not about like cracking and making noises. Sometimes people say, "Oh, I have my wife walk on my back and I feel good," but then the last one, boy, I couldn't get up. So it's not about cracking and making sounds and making. It's about restoring the curvature. The spine, when you look at it front and back, should be straight. From the side, it has the nice curve, and the curves they serve like a shock absorber, and they preserve, basically divide up the weight, so the muscles are working like a third of the weight, and then the back joints taking a third, and the disc. So it's all working together to keep the body basically functioning optimally without degenerating. Now, what happens when someone's spine is flattened from whether it's Thai massage or that somebody's walked on their back or whatever, or chronic tightness that stiffened up and straightened the back, and all they're doing is getting massages, but then nobody's dealing with the spine. Those people will be affected and will have in a negative way, and that is degeneration will set in faster, and that's what we call arthritis, degenerative joint disease. So it could be prevented. A lot of people have arthritis, and it could be prevented through proper exercise, proper treatment, avoiding just medicating and just putting a band-aid over a band-aid, or even massages. I see people, they go, "Oh, I have weekly massages if you want," and if I don't get it, I'm like really hurting. But then down the road, years later, I find these people have arthritis in their spine is because, okay, they palliatively relax the muscles, but then they didn't really mobilize or basically loosen up the spine, which is your lifeline. So basically, I recommend people see a good chiropractor that doesn't just do adjustment, but kind of works with the whole body, a holistic one, the one that balances your muscles, uh, balances, removes scar tissue, restores the proper balance and muscles and tone, all of that using physiotherapy or manually, and then also addressing the spine as long as there's no contraindication. Of course, chiropractors is very well experienced; they know when to manipulate, when not to manipulate, because some people they do have osteoporosis, osteopenia, weakening of the bones. Of course, obviously you can adjust those. So there's non-force. There's other techniques. I follow depending on their age group and all that. So that's important. But manipulation is definitely very important for restoring and correcting the spine. So another excuse me, another thing about massage is whenever there's any acute injury, like for instance, if you were just in an auto accident or you lifted something, a piece of furniture, or you playing sports and you injured yourself, or work injuries or whatever, usually there's inflammation involved. So whenever there's inflammation, you don't want to have a massage because you will make it worse. Even though the muscles will relax and at the moment you will feel good, but later the problem gets worse because the muscles are reacting to the trauma, and their job is to guard the splint to protect what the most sacred thing, which is the nervous system. And we don't want to relax those muscles before the pressure is off the nerve, before the inflammation out, the inflammation is out. And the same thing goes true for, I'm against where even under medical intervention, when someone is just injured, they give them muscle relaxants and painkillers. Well, guess what? You don't want to relax the muscles immediately. Maybe give them some painkillers. I could understand that, but better give them anti-inflammatories and encourage them to put ice on it. Okay, we don't want to put heat. I talked about that in a previous video. But yeah, the acute injuries, you want to put ice. You want to calm the body down. You want to get rid of the inflammation. Then, okay, you evaluated, you're clear. If that person chooses to have massage, then it's good. But I usually like Swedish massage, light massage, pressure points kind of treatment. I don't like the deep in tissue that really goes in deep and try. It traumatizes the body. The body does not like to be traumatized. I believe the body can be healed and balanced and in a better, healthier way than through like force and deep pressure to the point that person is very uncomfortable. So in short, massage has its place, but then there's those contraindications like I mentioned to you, and it's always good to seek like a holistic practitioner that really knows that and make sure there's no underlying problem, no nerve pinching, no nerve irritation, so that way you're not just either making the problem worse or just putting a band-aid through massage. I hope this sheds some light. If you have any questions or comments and you want me to elaborate a little bit more, if something was confusing, please feel free to put in comments. I will be happy to answer you. And if there's something I need to make a video to clarify and go in more detail, I will be happy to do that.